Wow, this stuff is confusing me, and I'm supposed to be the expert. What I'm not confused about is the American economy is based upon you being sick and being scared enough to buy some drugs that will make you sicker. Our health has been sold to the pharmaceutical industry. I love my doctor as much as you love yours, but it's very unfortunate doctors are being taught these days by very large and wealthy corporations whose motives are not to improve people's health, but to maximize profit. A short time ago, it was all over the news that a panel of experts decided to keep Celebrex and Vioxx on the market in spite of their dangerous side effects. They kept mentioning the panel of experts. I've never seen a news anchor ever reveal who these so-called experts are, where they get their funding, and what constitutes their political agenda. It turns out 9 out of the 11 panel members had ties to the manufacturers of the drugs they were supposed to be protecting us from. Oh, it's that bad, folks. Who are you going to call to protect your constitutional right to health? Experts? As my wise father used to say, experts, schmexperts. And I think the word schmexperts meant that 50% of today's health advice is wrong and obsolete. And I say there are two kinds of experts, both of whom you can't trust. You've seen them lurking around. There's the PR spin doctors who have a degree and not telling the truth. And then there are the independent experts, scientists who have been handpicked, cultivated, and paid to promote the views of corporations. The news media frequently uses the term junk science to demean health advocates. The PR industry has for decades spent millions of dollars funding and creating industry front groups. These groups wrap themselves in the flag of sound science. Their sound science is progress as defined by such nice guys as the tobacco industry, the drug industry, and so on. The public is not becoming more aware of these tactics and false experts. These tactics and false experts have become better at fooling us. What should make us all angry is that most of what the media transmits or prints as news is provided by the public relations industry. Who are you going to call? Not the experts. Oh, it can't be that bad, I hear you saying. Oh, yes, it is, so says I. Modern medicine has become so intertwined with pharmaceutical companies, it will let patients die before searching for alternative therapies. All this should make us wonder, what makes alternative medicine alternative? Maybe dangerous drugs and surgical procedures should be the alternative. Unfortunately, the answer is maybe not. The budget at NIH for research into alternative medicine is 0.5% of their entire budget. That equals $100 million. A pharmaceutical company will spend that much just to bring one drug to market. So there doesn't seem to be much interest over there in creating a better, safer system. Right now, preventative medicine means searching for more disease so more treatment can be provided. Health screenings for cholesterol, cataracts, glaucoma, blood pressure, and blood sugar are designed to increase sales, not prevent disease. You would think that preventative medicine would reduce the incidence of disease. Worse still, America could not treat all the undiagnosed disease that currently exists. If all the undetected cases of glaucoma, diabetes, and hypertension were diagnosed, it would bankrupt Medicare and the companies that sell health insurance. To avoid a future financial calamity and meltdown of the healthcare system, we need to reduce the incidence of disease. I know you want to say something like, but come on, Dr. Malakoff, we have preventative medicine. Well, you got me there, partner. Just kidding. Ladies and gentlemen, if there is one thing you remember from this talk, please let it be this. Preventative medicine is an oxymoron. Medicine means you diagnose something. All medicine is based upon a diagnosis. If you detect a lump sooner than usual, you have it. You haven't prevented anything. If you have it, you can't prevent it. So how about it, folks? Don't we deserve a different way? How about a better way? Let's talk about what's going good. Why do we really need to supplement? I'm going to drive a stake right through this vampire of a question, and hopefully it will never come back to haunt us again. A study at the University of California revealed that a nutritional deficiency mimics the same damage to DNA in living cells as harmful radiation. This same study found that the majority of the American population does not consume the recommended 5 servings of fresh fruits and vegetables daily. Anywhere from 2 to 50% of the American public exhibits deficiencies of these nutrients, which could lead to chromosomal damage. Folic acid, B6, B12, niacin, iron, zinc, vitamin C, and vitamin E. The study concludes that remedying nutritional deficiencies should lead to a major improvement in public health and an increase in longevity at a low cost. What this study says to me is, taking supplements gets me further away from the nuclear reactor. Whoever would have thought that being nutritionally deficient is as damaging to our DNA as hanging out in front of the x-ray machine? Even though that strange fact has me overly amused, I realize it's time to reveal my favorite life-saving secret before I put you to sleep and you miss it. Turns out the secret is not so secret lately. It's become big news that chronic inflammation is associated with all kinds of diseases caused by modern living. At this point, I have good news and bad news for you. The bad news is this is a complicated subject. The good news is you have me to make it easier for you. And you want to understand this because this is vital to you not getting very sick. Because once you understand the problem, you're going to love the solution. Chronic inflammatory states are associated with certain inflammatory enzymes. This may sound complex, but you've been hearing about this for years. You all heard of one inflammatory enzyme lately. It's called COX-2. Celebrex, Vioxx, and Bextra were designed to interfere with this enzyme. They were taken off the market because, as it turned out, they also interfered with life. Not a bad idea, though, to try and stop inflammation because it is associated with numerous diseases such as arthritis, osteoporosis, cancer, atherosclerosis, myocardial infarction, diabetes, allergy, Crohn's disease, multiple sclerosis, septic shock, AIDS. Oh, I'm running out of breath here. I think you get the point. Now, this isn't exactly the kind of inflammation you might be relating to. It's not that big welt on your forehead that arises after a golf ball flies into your yard while barbecuing. And it's not exactly like the inflammation that occurs after lying on a piece of aluminum foil for 5 hours in the hot Florida sun trying to make up for your lack of tanning ability. The inflammation that's causing disease at a cellular level is not as dramatic. You don't notice it like the dollop on your head or the skin that an alligator would be envious of, and that is what makes it so dangerous. You don't associate all those disease processes with something that you can't see, but the inflammation of the disease process is occurring at a cellular level. So that list of diseases I mentioned a moment ago alone sums up most of humanity's suffering. But did I leave something out? Something really big? Syndrome X. Why, it's so big they use that term from algebra to describe an unknown quantity. Syndrome X. That is the newest plague to strike Americans. That is also a very slick way to say we're fat and dying from it, which is where Gary began this conversation. And if you're not overweight, you still need to listen because there is still a high probability that you can wind up with one of those other diseases I just mentioned. Also known as metabolic syndrome and insulin resistance, Syndrome X is the driver for many diseases. What does all this disease have in common? Inflammation. Because diseases have inflammation as the common denominator, it suggests that these conditions are biochemically the same. The difference is in the location of the body in which the inflammatory biochemistry is being expressed. In other words, you have chronic diarrhea, they call it colitis. Your tummy hurts a little higher up, they call it gastritis. You're impatient and can't wait for the pain to start in your stomach. The pain is happening as the food is on the way down to your stomach. You have esophagitis. It hurts just to talk about what you're about to put into your digestive tract. You have laryngitis. So itis means inflammation in Latin. You may have noticed a lot of diseases have that suffix itis at the end of it. Doctors are trained to view disease. We memorize symptoms and certain specific disease markers, and we focus on the differences among diseases for diagnostic purposes. Dr. Bob, take a look at this itis in this patient's tushy. Dr. Jim, let's call this proctitis. Good idea. But look up here, Dr. Bob. He seems to have an itis on the other end, right here in his middle ear. Dr. Jim, let's call this otitis media. Media in this case is not the paparazzi trying to get pictures of a celebrity drinking too much. It just means middle. You walk into your doctor and tell him your ear hurts inside, and he tells you in Latin that your middle ear is inflamed. Everyone seems to be happy. And why do we doctors need to look at things this way? Because it's easy to pass our state boards with this view of disease. With this approach, we never learn what these disease processes have in common. But we're not talking about the kind of inflammation that a bacterial infection can cause. We're talking about the inflammation that occurs because of poor lifestyle choices. To interfere with the body's normal chemistry by trying to inhibit these inflammatory enzymes with drugs has caused hundreds of thousands of people to have heart attacks, kidney failure, liver disease, or just plain kill over and die. But only if there was a way we could reduce this inflammation naturally. So what is one thing you can all do to outsmart that horrible system I was talking about and prevent multiple disease states? You could eat low glycemic index foods. That means cut down on your sugar. Cut down on my sugar? Nonsense. Give me those pills that kill you. But I don't want to be negative here. Who wants to be told not to do something? So what can you do that would be just as useful and you can eat plenty of? Fruits and vegetables.